I see this all the time as a physical therapist. People in their 60s who used to love running, now they can't run at all. And it didn't start with something big. It started with some small knee pain they ignored, they pushed through. And if you keep ignoring your knee pain, you're not just risking discomfort, you might be setting yourself up for surgery. I'm Dr. Ray Peralta, physical therapist, run coach, and I've dealt with knee pain myself, and I've helped hundreds of runners get rid of knee pain in the past 10 years. However, I've also seen the folks who used to run and can't run anymore because their knee pain got so bad they ended up needing a knee replacement surgery. And if you want a copy of this Google Doc to learn more about how to avoid knee pain from getting worse, run for life, avoid surgery, I'm sharing it inside my free school community for runners, link in the description. So many runners unfortunately ignore knee pain until it's too late. They think, oh, it's just soreness. I'll deal with it later. They have this kind of reactive versus proactive mindset, like, oh, I'm just going to wait till it gets really bad, then go to the doctor, right? Pain comes and goes. It gives you this false sense of safety, the security, thinking, oh, it's not that bad. I'll just rest, right? And yeah, rest temporarily fixes it, right? Because the pain does calm down when you rest, but the issue returns the minute you start ramping up the activity again. And then you have inconsistent training, low tissue tolerance, right? And you may run, but oftentimes you neglect strength training or you neglect mobility training. And then that minor knee pain slowly progresses into a chronic injury, right? It may take a couple years, it doesn't happen overnight, but then over time, it starts getting worse and worse. And if you're not fixing the problem, you're oftentimes just delaying it, right? Oftentimes what happens is boom bust cycle where you're having a good day. So you go for a long run or something. You start training for a marathon. You overdo it. That knee pain flares up. You have increased pain. You rest to recover. Maybe you even, hobble across the line, but, you had to take lots of pain pills. The knee was all swollen. You had it wrapped up in bandages, a knee brace, etc. And now you keep wearing a knee brace because you think it's going to help you. But then as the years go by, that knee pain keeps getting worse and worse. So what actually needs to happen? So identify the root cause, not just where it hurts, right? Not trying to just mask the symptom. Because many times people will just go to physical therapy, get a little massage, some ultrasound, some ice pack, or they'll take a pain pill, or maybe get an injection. And that might help calm the symptoms. But then the minute you start ramping up the mileage, end up getting a recurrence of that same injury. Maybe not right away, maybe a couple months from now, 6 months from now, etc. And not ignoring mild pain and pushing through it, right? Being proactive instead of, again, waiting until it gets so bad that you have to react and you're in emergency mode and panic mode, right? Make sure you're getting enough recovery days, especially if you're dealing with a persistent knee pain or a reoccurring injury. I recommend switching to a 3 runs per week framework, even if you're training for marathon or ultras, right? Build your single leg strength and low tolerance, right? At least 2 to 3 times a week, you're doing focused work for that single leg, not just generic strength training where it makes like, but I already do squats, I already do deadlifts, or I go on the leg press machine, or I go to group fitness classes where they have me do a whole bunch of boot camp style classes. It's not about that. Oftentimes it's not targeted to your exact weak links and so random, you're not actually making results. It's more like cardio. Oftentimes many runners, when they do strength training, they treat it more like cardio. They're doing high repetition, low weight. Sure, they might getting tired, but it's just like another cardio weights, essentially. Make sure you're doing mobility for stiff areas at least 10 minutes per day. And it's not just random stretches where you just, I'm just going to hold a hamstring stretch for 30 seconds and call it a day. Or I'm just going to stretch a few seconds before I go for a run. That's not enough. You oftentimes have to do daily mobility work, kind of like brushing your teeth. You should be doing it daily. And everyone's going to have certain tight or stiff areas they need to work on. By working on those areas, you can oftentimes help keep this pain at bay or even get rid of it altogether. But again, if you're not sure what you're doing, and many times people are guessing, it's good to work with a professional, someone who understands runners, a physical therapist who actually get in there and help you instead of trying to do it yourself. And then you're just guessing and you keep having this persistent knee pain, even if it's low grade or minor to you. And follow a structured plan. Again, not just random workouts and not just the seasonal runner who runs in the fall and the spring. I got a fall marathon, I got a spring marathon, then it just disappears for the rest of the year. Stay consistent instead of reactive, right? Avoid those start cycles. Stay consistent, especially with a specific strength exercise, specific mobility exercise. Again, not just random stuff. Have a progressive plan to build up the load tolerance. And you don't need more rest. You just need a better plan. Again, rest alone will just calm the symptoms down. When you go back up and you increase the load, oftentimes that injury happens again, right? A lot of times running injuries are just because, or even with knee pain, even if, you're like, that knee pain is just related to something else. Oftentimes it gets exacerbated or worsened with running because running increases the load on your body, whether it's in terms of mileage or the speed or the hills, terrain, etc. And your body doesn't have the capacity to handle the load or the demands, the load tolerance, right? The tissue's not strong enough, or maybe it's not mobile enough, or just there's other factors. It could obviously even be sleep and nutrition that could be impacted. But essentially, you want to take a holistic approach to looking at your health instead of ignoring this stuff, thinking, oh, I could get away with it. I'm just in my 30s or I'm just in my 40s. But then it catches up to you as you get older, right? When you get into your 50s or 60s. So what happens if you ignore versus you fix it? If you ignore it, the pain becomes more frequent, becomes more intense. You start limping, and the knee starts to swell up on you, right? You start having increased inflammation. The cartilage starts to break down, right? This is where now the cartilage is really getting bad because you just kept ignoring it. It turns a chronic condition, right? Instead of just some generic runner's knee pain, starts becoming like full-blown arthritis, more wear and tear on the knee. Eventually, it limits your running altogether, then even your ability to walk, right? And this can lead to like having to rely on injections, like cortisone injections, maybe even eventually a total knee replacement surgery if you really let it get so bad. And I've seen this happen in folks in their 60s who, used to run when they were younger. They've done a bunch of marathons, but then they just kept ignoring through the pain, trying to mask it, wearing knee braces, and eventually ended up getting a full-on knee replacement surgery. And knee replacement surgery isn't cheap. It's about $30,000. Even if you have good insurance, sure, a lot of insurance can cover some of the costs, but even then you may still have to pay out-of-pocket expenses. It may come up to like $10,000 or so, and not to mention the hidden costs, right? Time off from work, or your quality of life. And in many cases, you get the knee surgery and you're still limited, right? You still have persistent pain despite getting the surgery. I do see this unfortunately happen to many folks who get knee replacement surgery. They still have persistent pain that lasts for a couple years after the surgery. They still can't fully bend the knee. It still hurts to climb stairs, even just walk. And about 1 in 3 knee surgeries is completely unnecessary. It could have been avoided, especially if someone was proactive instead of reactive, and just waiting until it got so bad that they needed to go to the orthopedic surgeon. So if you fix it early, pain actually resolves it and not just stays masked, right? Not trying to just mask with pain pills or injections. You get stronger, more resilient joints. You can, in fact, remodel your tissues where they get so strong that even though you may have had arthritis on imaging, that you can actually avoid surgery. I've seen this happen where we actually build up the bone density, doing targeted strength work, proper nutrition, ability to run consistently without flare-ups, better performance with less mileage, and long-term running longevity into your 50s, your 60s, 70s, and beyond. As a physical therapist, I see both paths all the time. There's the folks who kind of wait to the last minute and then they end up getting the surgery, and the people who are more proactive and actually take care of the problem. So in your 30s and 40s, you might be able to push through it, right? And that's why many younger runners tend to ignore it because like, oh, it's not that big of a deal. It's just a bit of a pain here, a little bit of knee pain. But in your 50s and 60s, that same knee issue becomes your limitation. And many runners I see stop running altogether because it got so bad they ended up getting the knee surgery, and they were still in pain. So if you're dealing with knee pain right now, don't wait. I have a few spots left in my calendar to help you run for life and prevent knee surgery. Book a free consult call on a first-come, first-served basis. The lesson most runners need to learn too late. Knee pain is a warning sign, not something to ignore. The cost of doing nothing is always higher long-term, and small issues become big problems if left unchecked. Consistency plus strength, mobility training, smart training leads to pain-free running. You don't need to stop running. You need to train like an athlete. Your future as a runner isn't decided by your age. It's decided by whether you take action now. If you found this helpful, like, comment, and subscribe, and I'll see you on the next one.